Yo, my back killing me, my neck killing me, my feet hurt. Oh, I want to get up to go exercise because I haven't exercised in about over a year, so I haven't gone walking. When I used to go walking, I lost like over 100 pounds after having gastric bypass surgery, and it took a lot of weight off of my feet and my back. It feels good, but the pain still persists because I have a metal rod in the back, right here in the middle of my back, the top is a rod in the thoracic spine. So I get a lot of pain that come across the arm, you know, from the neck into the arm, and it goes from the middle into the arm too. So it really is very sore. It's like I fell asleep with the TV on, and between the TV and the pain, it woke me up and wanted to use the bathroom because I ate late last night and drank some soda, some lemonade last night and tea and liquor soda. So I got up to use the bathroom. But anyway, I just want to say big up to everybody out there who's been supportive, because my mom and I, we've been trying to collect donations. But my mom been doing great. She had like over $10,000 of donations already for people in Jamaica, US dollars, 10,000. Plus she buy material and whatever she can and things. So the money finished real fast too, because there's a lot of people that trying to help. And then we brought down stuff to Jamaica to buy bags of things and barrels of stuff. So we did what we can in the meantime. And up to yesterday, I have another brother who brought more bags down there. So we've been, actively thinking about other people. And when the people donate, my mom told me that sometimes they want certain people to get the donation, and that's why the money finished so fast, because they want to get the money to like her staff or a particular staff or a particular place they want to help out. So either way, every little bit counts. So if you guys can donate some money to the Cash App, you can Cash App me anytime, or you can Zelle my mom. She has it on her page. I can tag her with this video. But yeah, but my mom's great. But it's just that I was sorting out my room. My room had like a whole lot of bins in my room with clothes, and my suitcase wasn't emptied when I traveled recently, because I just been tired and in the pain as well, and it's no rush. And then I didn't have the drawer space, but I got a chance to clear out the drawers and donate the stuff that I don't want anymore, because I lost a lot of weight, so I have a lot of big clothes. But I have a lot of small ones too, because I've been smaller too. So I go from like 150 pounds to like 250, 260 pounds, from whatever reason it was at the time. Between just not eating good and not exercising well, I really gained the weight. So I had the gastric bypass surgery, and it does not make me hungry. I could go the whole day without eating and I don't feel any way. If anything, I might feel a little tired, like, you know what, maybe I should just eat something real quick. And then I start eating and I don't really feel I get full fast. Because what happened, the gastric bypass was done, and right here, the stomach, the food don't go to the stomach anymore. It goes straight down to the intestines. So when my belly full is, the middle of my belly it just pouts up and puff out. So when I take some pictures like the other day and I see that my belly kind of flattened down, I'm like, yeah, that's sexy, yeah. So I posted a nice picture with my new lingerie, so I can show you how I slimmed down. Nice. And you don't even see the scars. I had like 5 different cuts from the bariatric surgery. They put the endoscopy like 2 places here, and then 2 places here, and 1 through the belly button. And it's like 5 different cuts they give you. Yeah. So, but nobody ever talk about the appetite afterwards and how you don't have any. You just don't have an appetite. You just don't feel hungry. It bad your fat. It bad. That's the gastric bypass. Not the sleeve or any other weight loss surgery. This one, bad. And I used to have gastroparesis, where my stomach used to bloat up all the time, and the food don't want to move, and I get reflux like crazy. I mean, the nerve really damaged to my stomach. So between my spinal cord issue and the nerve issues that I've had, it messed up my stomach. So the surgeon never even wanted to do the gastric bypass, but him said, man, maybe it might help him, not really sure, but it's no problem. I can't get the sleeve, him say. I couldn't get the sleeve because of my gastroparesis, because the stomach already kind of slow. So he didn't want to add any more stressor to the stomach. So we bypassed the stomach, so the stomach not do nothing anymore. Yeah, it bad. So either way, this is the first time I really ever talked publicly about it. Because I'm cool about my weight. I'm not fussy about it. I'm happy that I lost it. But if I gain some, I gain some. You know what I'm saying? Because I enjoy food. So I really still enjoy eating. And I do have some craves when I'm ready, where I crave some stuff. So yesterday I went to my doctor because I've been seeing all these videos with people who have pica, like they crave the soil and they crave like the clay and things like that, or the chalk and stuff like that. That's a sign of iron deficiency. And I know my hemoglobin was a little bit low, but my doctor ignored it, and I didn't like that he ignored it, because I'm a bariatric patient who was on bariatric vitamins and vitamin B plus B12, because all those things are necessary for me. I had to buy this special bottle of bariatric. It says bariatric fusion. And when I Google it, like I have over-the-counter benefits, they don't cover this stuff. This one's special. This one is like expensive and chewable, so it's tolerable. And it's like 4 of them I have to take every day. 4 big pills. And then I got my B complex that you can take 1 a day, which is pretty cool. I get it from Spring Valley, which is a good company. But like I say, I've shopped around for bariatric vitamins, but this one tastes really good. Fusion, it tastes nice. This is like a berry taste. I like berries. Some people don't like berries. But anyway, that's about it. One of these days I'll show you my scar when I'm dressed a little differently. I can show you the scars of where they went in laparoscopically to do the surgery. But it was a long surgery. I was in hospital for probably about they give you days. I forgot how much days I was in there, because they training you about the diet when you're in there, and you can hardly eat when you just get the surgery. Nothing stays down when you get the surgery at first. Even if it's a little thing I want to eat or drink, it couldn't stay. It was not going forward and thing with that was my situation. And then after a while, just eating little bit at a time, it go down and digest. So my body kind of get used to it after a while. And then I get bigger meals and bigger meals. But I started off with like liquid only. Just liquid. And like I said, I wasn't really hungry, so I invested in the protein shakes from Walmart, like the no-name brand them. That's the cheapest that I could find, with 30 grams of protein, good amount of protein. So they said that you don't stick to the protein so that I don't get hungry and I don't lose muscle, because I'm not eating well. So just to give you guys some guidelines about the bariatric surgery, so you mustn't starve yourself. Make sure you pack up on your proteins and fiber. Fiber is really good, so you keep your bowels going and you don't get constipated and so forth. Because some of these medicines can make you a little constipated, or just, not drinking enough water and stuff. So drink up your water, do the protein. And I never had to exercise, and I lose 100 pounds over a year. You know what I mean? So that's it. And I did try some of the semaglutide. Semaglutide is a diabetic medicine, or it's indicated for diabetes, but it's also indicated for weight loss. It's a GLP-1 medicine. That's what they call it. But they have GLP-1 and 2, which is like tirzepatide. I wasn't on that, but I tried the Ozempic. I did that. People ask me if I tried something. I did the semaglutide. That's a generic for it. You can buy them online and take them orally every day. You can take 1 a day, or you can get a shot every week. So if you want a good doctor to deal with you, whether it's bariatric surgery or the Ozempic or just somebody to talk to or anything, you can always inbox me, and I give you the link to my doctor here locally in Florida, and you can link them at the office, or just ask your doctor about it, because a lot of doctors are doing it in their office and trying to make money off of the weight loss, you know what I mean? But it's online too. Like I say, you can do it yourself and just continue weighing yourself every week. Choose a day out of the week, and every week you just give yourself a shot of the Ozempic. But that's about it. Hopefully those tips help you for today. I didn't want to be too long on the video, but I ended up going about 10 minutes today, because I can talk. I have a lot to say. So we'll just get to them bits, a little bit by bit, because I've been enthusiastic to share these things on Facebook again. I've just been caught up with my son, just living everyday life and thing, and Facebook recommended that I do posts every week and so on to try to make a little income from Facebook. So I've been making these posts purposely too, so I can educate you guys, but also if you want to buy stars from me, you can buy stars. If you want to subscribe, you can subscribe. But either way, I just want you to just learn, you know. It's not about views or popularity. I'm not that type of person. I just like to share information to make people happy and give people hope and be positive. So big up you guys. Big up yourself. Big respect from Karen and Anita again here, the real Dr. G. This is Dr. G endorsed. Blow. Bye. Little more. No, we not said bye. We said later. Later.